reports have it that in Kenya, cancer is the third leading cause of death after infectious as well as cardiovascular diseases. The condition exerts quite of heavy, psychoeconomic burden on individuals, on families, households, and the entire communities through the loss of lives, aspect of productivity, cost of care, and so much more. We have equally seen lots of, premature deaths being reported. Even worse is that we have cervical cancer, and is one of the most common cancers among the women, with data speaking of, data from the World Health Organization speaking of the fact that it's the fourth most common cancer among women globally. And so it is very important that we get to this conversation as we get to understand the nitty-gritties of, cervical cancer, whether this can be avoided, whether, you can go for screening early enough and, get to save yourself from the hard times that come along with that. And so joining us for this conversation is Dr. Victor Ngani, who hails from the RFH, Ruai family, RFH. Yes, sometimes you can be tempted to say RHF. So it's the Ruai Family Hospital. And Dr. it's an honor to have you this morning as we look to learn more about cervical cancer. I know that on numerous occasions this has been spoken about, but we do not stop. We do not stop because screening continues, and most of the ladies do not know whether there's the existence of this. Sometimes it's free, but we still do not take up the advantage of doing this, go for screening to make sure that we are able to take care of ourselves at a very early stage. And so as we speak of this, we have about estimates that have been projected out there. It is clear that there is a problem. It's even worse when we're speaking about the treatment aspect. And so far so good. We'd love to understand the strides we've made, but before it even gets to that level, it's very, very important that we understand what cervical cancer is.
Thank you, and thank you for having me on the show. And I was just listening to you, and you're spot on, because you've spoken about some important aspects of cervical cancer, the how common it is, and the issue about screening. We'll get to that. Cancer in general, it's a big word for many diseases, and the hallmark of this is that there are cells that are growing in a way that is not regulated.
Okay.
If you look at the way you've been created, you'll find that your nose is in the right place, your skin in the right place, your liver in the right place and the right size. And this is because the body has a natural mechanism for making cells grow, and then they're limited. They're under some form of control and coordination. So cancer happens when these cells become, the control goes away, and then they grow, exponentially very fast, eating into spaces where they're not supposed to eat into, and they can spread from space to space. That is cancer. And there are many, many types of cancer. There's not one particular type, they're different. Today we focus on cervical cancer. The cervix is you'll call it the entrance to the womb. You can't see it from the outside, but up the birth canal, then just before you get to the womb, then you'll find the cervix. There's about an inch long and a little bit, almost the same width. And it's one of those cancers that you can prevent and also you can detect very early. Okay. You've mentioned the fourth most prevalent cancer across the world, but in Kenya it's the most common cancer amongst women, because there are differences geographically, differences socioeconomically that make cervical cancer very prevalent in this country. I think over 4,800 women suffer cervical cancer in the country every year are diagnosed, and unfortunately almost half of those people do not make it as a result. Globally, we're talking about 600,000 plus cases of cervical cancer with a very high number of deaths as well.
Oh,
yes, please.
That's quite unfortunate. But then again, I'm glad that the world is out there and speaking about it. And like you rightfully put it, back then there were no these spaces of where people would go and get screened. But I'm glad that most of the centers you go to today, you're told cervical cancer screening for free. And I guess girls or women are taking up, the challenge to proceed and get, the screening processes. So what exactly causes cervical cancer now that you speak of the fact that it can be avoided, can be screened early?
It's interesting that well over 90% of cervical cancers are associated with a particular virus, the human papilloma virus, HPV. Now, HPV is a sexually transmitted virus. Okay. It's the most commonly transmitted virus across all STDs, it's the most commonly transmitted. More than 80% of sexually active adult people will have or have had a HPV in their lives. Now, there are many, many strains. I'm glad COVID came to the point, got us to a point where we understand strains. This virus has over 200 different strains. Now, there are some high-risk strains. They have numbers. So number 16, number 18, for example, are high risk. Others are not as high risk for cancer. Others don't cause cancer as commonly, but cause other severe illnesses like warts, for example. So HPV has been known to cause well over 90% of cervical cancers. And as a result, a lot of the processes or the measures that have been put in place to reduce the spread of cervical cancer has been targeting HPV, because the idea is if you can stop a child from getting HPV, then you can stop them from getting cervical cancer. The other factors also that relate to immunity, we'll talk about this as we go along.
All right, well, fair enough. And signs and symptoms.
Even as we talk about cause, so that's the biggest one. Of course, there are other risk factors for developing, severe cervical cancer and then severe forms of it. One of these is smoking, and we'll speak about this. We can't speak about it enough. Smoking has no benefit. I think this has to be said. And many people start smoking because it looks cool, and because they see other people doing it, and there's this view that perhaps you can smoke and it's just fine. It's not. And in fact, a lot of people who've gotten stuck, who've been smoking for a long time, they can't stop. It's very hard. So the best thing is to not start, because smoking will cause significant risks to you in not just cancers but other areas as well. Now, someone will ask me, what about so-and-so who smoked for all their lives, they lived 210 without any issue? Yes, that happens, but the risk is much higher when you smoke. And if you can, don't start. And if you've started smoking, if you're able to stop, please stop. But essentially, don't smoke. Other factors also include immunosuppression. Immunosuppression is if your immunity is lower than expected, and especially HIV in particular has been very notorious for increasing the risk of getting cervical cancer. Then there are sexual factors, for example, having multiple partners, early sexual debut. This increases the risk of you getting, can I say, the kind of HPV that will expose you to cervical cancer, amongst other factors. Yes.
All right. Well, most of the women would probably want to understand, this on the aspect of the engagement sexually, but even before it gets to such levels, cleanliness, what it is that you eat and all that. This aspect of saying that it's genetical this also, things that can be incorporated in the list of risk factors? Yes,
absolutely. So two things. If you've had a member of the family who suffered from cervical cancer, there's a risk that you could also get cancers, because the genetic component to cancers in general. And I don't know whether I spoke about having multiple sexual partners in addition to the...
You mentioned that.
Because all these factors are actually quite related to,
all right. Well,
cleanliness maybe not so much, other than practicing what would be called safe sex. Now, safe sex is the ABCD of it. A is abstinence. If you are not in a married relationship, then if you can avoid having sex, the better for you. No need getting yourself into a risky space. And then B is being faithful, because if you have intercourse with multiple people, then the risk of getting a strain that will put you at risk is quite high. And C is use a condom. That's the contraceptive method that acts as a barrier. Remember that cervical cancer, unlike many other STDs, can be spread by any form of intercourse. For example, if you are to even can I say a hand to genital kind of contact, this can also cause you to be infected with HPV.
Well, that's interesting. We speak of the signs and symptoms, and sometimes when we're talking about medical conditions, they always, the flow of questions is always like, what is the cause, what and everything. It goes to this particular level, and so sometimes, like you rightfully put it, we probably do not go for screening, and we stay until you get to hospital, you're diagnosed, you're told it's on stage 4, and you do not understand how. So sometimes we tend to overlook, the unusual, ways that our bodies behave, to a point where we are diagnosed at a very late stage. So what are some of the signs and symptoms that would get you having worry, that would get you thinking it's important that I seek medical advice? And at what level then would you opt for screening, even before it gets to these levels where there are some unusual occurrences in your body?
Okay, so for cervical cancer, like most cancers, initially you'll have no symptoms. Literally, you'll actually feel fine at the early stages, until you go for screening and it's found incidentally. And that's the best time to catch it, because for many cancers, by the time you have symptoms, it's already getting late. But then now a little bit more advanced, then certain signs and symptoms that begin to appear. You have bleeding when you're not any form of bleeding that's not your usual menses. You can have bleeding in between periods. You can have bleeding after intercourse. So these are all signs of worry. Then you may have some pelvic pain. You may have some foul smelling odor, and some discharge. And all this should normally prompt you to seek medical advice. Yes.
All right.
Now, again, if it's very advanced, other factors come into play. Cervical cancer is notorious for blocking the urinary system, the ureters, and as a result, then you have signs of kidney failure and other complications that can arise as beyond what we've
and I mean, that would have been my question. Just what else would occur after one has been diagnosed with cervical cancer, and even the connection of the same with the likes of fibroids, cysts, and all that? Yeah,
you said something very important. Many of us actually wait until we're in stage 4, and how does that happen? Because we missed the chance for screening. And again, just to illustrate, stages, when you talk about stage 4, it's a cancer that has spread beyond where it started from. So you will find it's spread maybe to the brain, to the lungs, or to the spine, or something of this nature. That means that really there's nothing you can do to control that. As opposed to very early on, when it's localized to a particular place, you can even remove it surgically, and that becomes curative. And so as we speak during this conversation, we'll actually look at instances where the opportunities that we will have missed to have arrested this and perhaps gotten rid of the cancer, as opposed to what we do, which is to wait for the symptoms to come. And by the time symptoms come, normally you are talking about stage 3, stage 4, and the cures are very difficult.
All right, before we even speak of the relation to what you speak on, kidney failures and the cysts and, the difficulties that generally women go through. Screening, what goes into the process of screening? Pap smear, and, you are there, this is what to expect. Sometimes, these talks come with lots of fears. Maybe that's the reason why a majority of women would opt out as opposed to going to get screened, at an early stage.
Okay, so screening is basically just looking at the population to try and find, something that is not, whatever it is you're screening for, is just looking in the general population to pick it up. Yeah. And here is sort of some form of surveillance. You're looking to see whether this person could have cervical cancer, or there could be changes in the cervix that could lead to cervical cancer. Because it's a continuum, right? You start from just some abnormal cells, which then grow into something else, which then grow into precancerous cells, and all the way into cancers that become advanced. And fortunately, the cervix can be seen fairly easily. What you need to do is to insert a speculum, then you can inspect it. Now there are a couple of, I would put it at 4 different types of screens that can be done for cancer. The first is visual inspection, which 2 types. The first 2 are visual inspections, where the specialist or the general healthcare worker looks into the cervix, then applies a bit of something, acetone, makes it change color. That is called visual inspection using acetone or acetic acid. And then the other one is to visual inspection using iodine, and you'll see some color changes. It's very simple, very fast, and if you see the changes that you're looking for, then you can actually tell that this particular cervix has some abnormal cells. Now the next one is a pap smear, which has become sort of gold standard really for screening. And what you do is you take a sample from the cervix, and then you put that on a slide and send to a specialist. Now the first way I mentioned, a nurse can do that, any basic healthcare worker can do that, because and it's actually quite accurate. You'll actually pick out a lot of abnormalities very early. The third one, the pap smear, is a bit more advanced, because you have to take a sample specimen, take it to a lab, and then a specialist looks at it to see if the abnormal cells are within that smear. Something we don't do as much as we should is a screening test for HPV. So you've heard of, they people do COVID DNA test, right?
Yes.
Okay, it's an RNA test. COVID RNA test is sort of what we do, the test for COVID. You can do a similar test for HPV. So this is another screening test that can be done where you actually take a specimen and then you take it to the lab and check whether there is HPV infection. And if there is, then it means that you're at risk and perhaps you need to go through the other measures of screening. So these are the basic screening tests. Of course, beyond screening, the other tests that should be done later on in case you find something abnormal. And maybe I can talk about that immediately, because if you find the cells are abnormal, you need to do something called colposcopy. Colposcopy is a process that is pretty straightforward, very simple, where the cervix is visualized under some form of magnification, some microscope. It's not widely available, but it's actually something that can be accessed and should be accessed by many women routinely. And then using also the same kinds of dyes, you can actually see if there's an abnormality. Then we have biopsies can be taken, and this can tell us exactly what's going on in the cervix.
Okay.
In terms of screening, again, the question is how soon should you start screening and how often should you screen? Should screen from the age of 21. That's a starting point. And you should do this all the way until you're past your childbearing age. And if you're the only people we say are safe and don't need to do these kinds of tests anymore, anybody above 65 years old, you don't need to be screened.
Okay.
But anybody after the age of 21, every 3 years, we recommend you do a pap smear.
Why past the age of 65 is not such necessary?
Well, number one, because at that point, the changes that would be taking place have already probably taken place, and the risks that are associated with HPV are pretty much
lower?
Yeah, much lower for the population. So that age we don't see as much cervical cancers, and also you've gone past that age where these changes become manifest.
And so you say you can start from as early as?
Age 21. Actually, it's recommended from age 21.
Okay.
You should do pap smears every 3 years.
All right.
And that means, you can...
Even if you're not actively engaged? Sexually?
Even if you're not actively engaged, actually you should.
All
and
right.
more so if you are actively engaged. But if you're not actively engaged, still from age 21, please do a pap smear every 3 years. Yeah.
I mean, before it even gets to levels of, pap smears and screening and all that, that's the reason why I was asking the relation of the same with these other, abnormalities, in a woman's body. And, we're talking about fibroids, we're talking about cysts. And, there's seems to be a lot of confusion as to the same, because in most cases you realize that, the signs and symptoms are more or less, the same. And so most of the women will tell you therein they get confused. And therein, again, there's a lot of misdiagnosis that plays out, especially when you're dealing with quack doctors. And so before it gets to levels of screening, how best can we be able to arrest such cases of misdiagnosis, and how then can we say there's a clear difference between cancer or cervical cancer and all these other
You're baiting me, and I'll tell you why you're baiting me. But you said it perfectly. The reason why there's confusion is because a lot of these things you've mentioned, fibroids, cysts, the symptomatology is similar. You'll have abnormal bleeding, you'll have pain, you'll have bleeding between menses, and you may even have some forms of discharge that's worrisome. And so it's actually very difficult to tell one problem from the other just from the symptoms. As a member of the key thing is, no matter cause, for you is to find out if you have these abnormalities, and if you do, just see a doctor. And you've said it, that there are many quack doctors or some substandard place, and this is why I'm saying you're baiting me, because today at RFH we are doing a free screen for mothers every Tuesday, completely free with a specialist, for any of these things you mentioned, cysts, fibroids, every Tuesday, because there's a lot of these cases that go undetected. Someone has heavy menses that are unaddressed for a long time, and we've noticed that there's a tendency where people who are not qualified per se, could even be healthcare workers, are giving what we call help. And so it's very hard for a mother to be connected to real competent help. And then again, the other places where the resources are limited. So I spoke about colposcopy before. So it's something that should be basic, but you'll find it in less than 10 hospitals in the country. So having these things set up would be of great benefit to the mothers. Now, when you see a specialist, they can tell you the difference between fibroids and cysts and cancer.
Right.
But it's important to tell that difference. And if it is cancer, you want to pick it up early, because if you go to a low-level facility, there's a risk that if the cancer is very early on, where it's, I mean, it may be missed. It's not. They may miss it completely, and as a result of that, you end up presenting much later and getting treated for something else for a long period of time, and by the time you come, it's too late to do something about it.
All right, I'd love to know whether there's anything to do with vaccine in this particular case, and whether, you know, there's some individuals that are eligible to that. But I think before we get to that level, it's important that we take a short breather, come back, also understand how much more, you know, the cervical and how fast, you know, cancer can spread the moment there's that diagnosis, and you know, just how important is it for you to be screened, detect this early, and whether there are any forms of treatment that would come along with that. That would help, you know, will be helpful at the end of the day. So we take a short break and we come back with more from Dr. Victor.
Yours is yours.
Monday, 7:30 p.m.
how early, how aggressive your HPV was, how aggressive the tumor itself is, and it can vary widely. And if ever you got help, if you catch it early, you can actually cure it completely. If you don't catch it early, then you'll present when it's almost late, and you have just a few months after diagnosis, because the cancer has spread to many places. It differs widely from person to person.
So probably just speaking to the people who are listening today, and they would really want to be convinced as to why early screening is very important. Does it then lower your risk of getting cervical cancer in any way, or what just exactly plays out?
Sorry, early screening, you mean? Yeah, early screening will save you. It will save lives, literally, because every single case of cervical cancer, every single one without exception, could have been picked early. And if it was picked early, then we could definitely have cured it if it's picked early. I think that's the most important part. Okay, maybe you may still lose 1 or 2 patients, but not the 2,400 you're losing every year. Like 90% of those cases, if they'd been screened early in a competent place, because it's unfortunate sometimes people are screened and the screen misses the cancer. But if this is done regularly, 90% plus will not be in that situation.
But someone would want to say that my wish is that if I go for the pap smear processes, then it would lower my risk. Is there, I mean, in any way, does it lower your risk of getting cervical cancer? Not really.
No. It checks. You see,
just checks. The
screen
detection.
Early detection. That's what it is. We'll talk about something else that will lower your risk.
Okay.
And those we'll discuss actually. It's super important. But this screening is just to detect it early. Surveillance. So you have your home. There could be snakes in the vicinity, and so you have a surveillance system. Every so often you go around and check, are there snakes around? If there are, you take care of them. But if you relax in your own house and just wait, then before you know it, they're all in your house and you can't do anything about it. And I'll tell you also, as a young doctor, one of the biggest, it's extremely distressing to find a patient who you can see they have cervical cancer that has spread, and one of the places spreads to is the pelvic region, which is where the ureters are, and you can tell this patient will not survive, and you can see the hope, and they're looking to you as a doctor, asking you, what can we do? How do we progress from here? And they give everything they can, but you can see the starting point is already too late. And if you can avoid that, and it can be painful, extremely painful as well. So it's not something that you want to take easily. I know that even as I'm speaking about this, there's someone who's in that very same situation, and there's, they could tell you how they would wish they'd been screened earlier. And perhaps, if for nothing else, to listen to the stories of those ladies, those of us who are not in that space, to understand the value of screening. Yes, most screens will come back negative, but we are screening because of the thousands of women every year whom we'll find have cervical cancer. And there are no effects to screening? Screening is no very side safe. Effects? It's a very simple process. Maybe a bit of discomfort inserting a speculum, which is, it's not bad, and then they take a sample and it's screened. Look, 4,800 people, ladies, every year in Kenya are diagnosed to have cervical cancer. Do you know which 4,000 they are? You don't, and that means it could be anybody. Right. So it's better to, just catch this early and not be in that statistic. Upon diagnosis, can one carry a pregnancy? Does it alter you for fertility? Or does it alter your fertility? Yes, it does that. At advanced stage, definitely it alters your fertility, but very early on, you could still get pregnant. But of course, it's very, very complicated, because if you're to get pregnant while you have cervical cancer, then the risks are huge. First, it will grow a little bit faster, and then the risks of bleeding are very high, and certain risks to the child as well. But I think when you have cervical cancer, then pregnancy is not the biggest concern at that particular point. The bigger concern is, how do you save this life? Of course, there are treatment options, and again, if it's caught early, then there are options that can retain your chance of giving birth. But if it's late, then one of the treatment options are includes to remove the uterus, and that means that the chance of delivering conceiving is quite reduced. And so when we're speaking about the development of this particular cancer, so early screening, and when now it's detected, diagnosed, and you start early treatment, does it then alter the development of the cancer? Or yes, but maybe, I don't know, this is the time to talk about something you alluded to, prevention. Yes, prevention. Yes. And there is the effective vaccines against HPV. So if you understand that HPV is sort of a necessary prerequisite to getting cervical cancer.
Okay.
Then if you can prevent HPV, then you can prevent cervical cancer. So this is where prevention takes place. Of course, all these other measures we spoke about, safe sex and vaccines, those are the two approaches that we can take to reduce the risk of getting cervical cancer.
So who are eligible to these vaccines? I mean,
anybody in the childbearing, anybody who's possibly sexually active in the childbearing age, and also a bit earlier than that. So currently, the strict tiers when you're supposed to get the vaccine will be between age 11 and age 12 before you become sexually active. But you can be given as early as 9 years and all the way to age 45. Now, there are many vaccines that speak about the ages of between 11 and 26 or 9 and 26. But in fact, studies have shown it's very safe for mothers for any lady up to the age of 45, you can get the vaccine. Now, of course, this vaccine is best when you don't already have HPV in your system. And how do you get HPV in your system? If you've already been in contact with somebody sexually, then the risk of getting HPV in your system is very high. But nonetheless, the strains are different. You could have a very innocuous strain as opposed to these high-risk strains, and therefore getting vaccinated remains important. The vaccines, there are 3 types now, I think, available. They have efficacy against a few strains. I think the highest number is 9, but these are the most notorious strains that cause cervical cancer. What else? In this space, there's a big concern about vaccinating children. But if you understand what the medical world is trying to achieve, then you understand why these children should be vaccinated, because it's better to get the vaccine into the child before they become sexually active.
This is the confusion then. If the recommended age for screening is around 21,
yes,
and you can vaccine at the age of, say, 12,
yes,
it gets me a little bit confused, because then I would want to imagine before you are vaccinated, then screening has to take place.
So vaccine is preventing HPV.
Okay.
Screening is looking for cervical cancer.
Yes.
So by the time you have cervical cancer or the precancerous cells or the changes in the cervix, by the time you get those changes in the cervix, it means you already got HPV. It's been in your system a long time, and it's really modified for a couple of years, normally around 10 years. And it's been in your system that long before now you can see these changes in the cervix. So that is the real difference. So if I did a screen at the age of 9, it's completely, first of all, it's difficult because it's a bit invasive, and then you will not find anything because the HPV hasn't come into your system, it hasn't changed your cervix, and these changes take time. Actually, it's a long time.
Say someone my age, probably not been privileged enough to have gotten the vaccine, but I'd love to get it today. So I have to go through the screening process?
No, you can get the vaccine
without going through the screen. How does it help if the virus is already?
So you, as I've said, there are different strains. And this particular vaccines are protecting you from the high-risk strains. And the most vaccines would talk about age of between 9 and 26. But again, studies have shown you can actually get it up to the age of 45. And it's safer to have that because it's a very safe vaccine. Safer to have that as opposed to not have that vaccine at all. Yes.
All right. Well, we've talked about screening as well as the abnormalities that come along to that. Who is eligible to this? Let's come to treatment, which is very, very important. And I don't know whether in this case it's treatment in totality or it's managing once you have been diagnosed. If you diagnose early, treatment in totality. That's objective. In fact, if you just find a few cells that have changed, their pattern, they're precancerous, there's something called cryotherapy. Cryotherapy is just temperature, very low temperatures. We apply a certain, there's a way to apply cold, very cold temperatures to the cervix, and you do it for 3 minutes, rest for 5 minutes, do it for another 3 minutes. And that is curative in many women, over 90%, who have what we call just minimal changes, precancerous cells. You can imagine that is how many minutes in total? That's about 13 minutes in total. 11 minutes in total. Cures cancer if it's caught very early.
A bit later on, then this will not work because it's a bit more advanced. Then you have to do something called loop excision, where you actually take some sort of a hot knife, well, not a knife really, but a bit of a there's something you do. It's just like a wire.
Okay.
Basically, you cut a small section that has that, and you actually is curative. It's called loop excision, and you're able to take that out. A very small piece. So again, you can see the level of treatment goes up. Then now, once it's actually cancer, then if it's very early on still, you have room to actually now do a surgical procedure that unfortunately now will involve removing the cervix and removing the womb together. And then further on, you have to remove a lot more tissues. And then it goes on until a point where surgery will not help. So this is the surgical options. Very early on, very curative, and as you progress, it's harder, gets harder and harder. In addition to surgery, there is chemotherapy and there's radiotherapy. And so all these things become necessary depending on how advanced it is. And this is why we keep emphasizing the need for early detection. Early detection. So go to a good facility that has the chance to pick it up. And we speak a lot about pap smears. I'm going to remember this word, colposcopy. Get colposcopy done if you have the chance. It's not. It's actually not invasive. Well, it's a little bit invasive because you're using a speculum, but other than that, it's very safe and will save you because you're using a microscope rather than your own eyes to actually inspect visually. And if you can do this regularly, it's not too expensive. You get these kinds of things done, you'll feel much safer.
All right. When you speak of these processes of treatment that are a little bit different, what are the side effects notable for that matter? Because we've had these difficulties with the chemos and all that you have to lose your hair and all that. So what is to expect when now you are undergoing treatment?
Well, the side effects are quite can be a bit significant. Fortunately, in terms of chemo, there are newer regimes that target cervical cancer that are a little bit friendlier. So chemotherapy, there are some harsh regimes, but then if you have access to the better regimes, then apologies, that's a little bit better tolerable.
Okay.
Radiotherapy in general is quite harsh. Depends also on the machines that you're using. And I think on that I'll give a comment. I know there's been this big clamor to tell patients they must go to public facilities, but there's a big difference. Radiotherapy machines are not the same. In some centers we use the cobalt machine, which is basically outdated. It's going to irradiate a big area and cause a scarring in all those areas and cause severe pain and severe complications for a long period of time. And the newer machines that are able to just irradiate the precise place and just target the cancerous cells in that space. So it's important for all of us to just note these differences and perhaps urge every facility that's offering radiotherapy to do with old machines that are very harsh on the body and bring the newer machines. And if you don't have it, please let people know that this is the limitation you have. That's radiotherapy. In terms of surgeries, then of course, because the more advanced, the more radical the surgery, the bigger the consequences. The most significant one in the advanced cases is you'll not have babies after that. And then of course, if you remove the ovaries as well, then there'll be hormonal imbalances that then become an issue as well. For the procedures that are much lower, the cryotherapy and the loop excision, you may have a bit of bleeding, some discomfort, but these tend to recover. You recover very quickly, and these tend to be limited in terms of duration.
All right, fair enough. Now we speak of treatments. If you're lucky enough and you get it in totality, then you're safe. If you're not able, maybe it's at stage 4. How do we manage this then?
Yeah, that's a hard one. That's a hard one because that's a part where as a doctor you look at a family and you want to shed, because you see cervical cancer doesn't know age. You'll have very young people in their 20s, beautiful people full of life, brilliant, and you can see that no matter the conversations you're having, it's just a matter of time before it becomes impossible. And that's a hard one because you will manage the pain. We manage the pain. We will try and keep the person comfortable. Sometimes when the ureters are blocked, then we can do what is called a bypass. We put a tube into the kidney directly to drain urine out. All these invasive procedures, some very extremely painful. But these are your sort of, would I say, just managing, as you said. It's not curative at all.
Right. And you know, it's now that we're talking about screening, probably it's very important that you know, we encourage people to go out there and be screened as early as possible. Maybe the best way to do this is probably sometimes, you know, to speak of the fears that come along with that, and this would probably get you thinking twice and saying, you know, that tent that you've been seeing there written, you know, free screening for cervical cancer, and you just bypass and overlook. Maybe it's time that you just get there and get to hear what it is that they're doing. So, life after cancer. And when we speak about life after cancer, we definitely are speaking about family. We're talking about you know, individuals maybe who have already gone through treatment or undergone treatment and, you know, are healed in totality. Are there chances of recurrence?
Unfortunately, yes. Okay. And so if you are a cancer survivor, then I'm sure you know this already, that you should work with your doctor and have regular checks. And I've noticed, and actually it's a good practice, that many cancer survivors actually talk about you know, their remission periods even 10, 20 years after, and they still consider themselves, you know, in the process of getting better, because you keep checking every so often. And yes, there are chances of recurrence, but the good thing is many of the people in this space are sensitized, and whenever there's a recurrence, they can pick it early. And also equally good is that there are things that come up every day that would generally aid in the fight against cancer, new regimes, and new diagnostic models, new methods of delivery, and all these options exist today. For the families, for us to be supportive, as always. But something that we shouldn't lose is what you said, because our normal tendency is to pass by that tent. That's what you do, because I'm too busy, until you're not. Until you're caught up in something that you wish you knew. You know, there's this Swahili saying that has, there's no equivalent in English. Majuto ni mjukuu.
Right.
Yeah, the regrets come much later. And so it's important for us to take note of that. And perhaps if just one person, because of this conversation, goes for a cancer screen and finds they actually had precancerous cells, I think our job is done. And I do wish it's not one person. Right. I do wish it's thousands of ladies that because of this show, they'll go out and get screened. That's
true. All right. Life after cancer, once again, for those ones that are lucky enough maybe to have gotten treatment and, you know, have reversed the whole thing, and they still are hopeful, or probably, you know, or even before treatment, those ones that are hopeful of, you know, siring, hopeful of conceiving, how different is it for them? How delicate and how special then are they handled?
Well, as I said, there's an issue if you've had advanced surgery that involves you are not able to conceive. But if it was this the precancerous cells, and you had both lip excision or you had cryotherapy, then the chance of conceiving is actually quite high. But you must work with your specialist. Because there could be some changes depending on the cervix, what was done, then there will be need to be supported or assisted, because it's in its natural state. So for that particular one, it will differ from person to person, but just make sure your gynecologist, obstetrician is with you throughout that process. Yes, please.
You know, they say it doesn't make sense until it hits home. And sometimes it's a common occurrence. And I'm glad that you started by speaking of cancer in general, yeah? And so as we come to a close, we still are having lots of discrepancies as pertaining to cancer in the country. So when that one prominent person passes on is when we now have these talks of oncologists. Is it oncologists, right?
Oncologists, yes.
We have talks of, I don't know, what we need to do to the Texas Cancer Center, what needs to be done, you know, at our, you know, FH and all that. Just what will it take for us to probably get there? And I'm glad that you at one point mentioned that, you know, if these machines are quite old, let's get new ones that will make the burden even less.
Isn't that the tragedy of our country? And it's the saddest thing that today, and I'll digress a little bit, the ordinary mwananchi, and ordinary here is anybody who's just trying to make a living the right way, we don't seem to matter. And that's a reality. I think we need to be alive to that. Because if you hear about cervical cancer only, over 2,000 something deaths, 4,000 something survivors. If you hear about breast cancer, if you hear about prostate cancer, if over 20,000 people, over 30,000 people are struggling, you know. But it's only when that one prominent person gets affected, then we realize there's an issue. But these issues are with us the whole time. So couldn't we be a little bit more deliberate? And can't we understand that if it matters for the politician, it matters for the mama mboga. We call her the mama mboga, but for the teacher, for the nurse, for the policeman. I'm afraid that very soon, if you're not rich, actually even now as it is, if you're not rich, you don't stand a chance. And we have to change that. I'm hearing this discussion around restricting, stopping the poor man from going to private hospitals when they have an HIF. It's not by choice that they're going to that. You know, my uncle, he had a form of a throat cancer recently. He's my uncle, but he's my age mate. We grew up together, exactly the same age. I saw the impact of the radiotherapy on the throat. He had severe burns and he couldn't swallow and there's terrific pain. And this is because we chose the better machine that causes fewer side effects. And I'm wondering how much worse it is for those who have to use a cobalt machine in Kenyatta.
Okay.
You know, this difference between the rich and the not so rich, that should be bridged. And I must say there's a group of people who are very careless in their speech because they have access, they can go to America, they can go to the biggest private hospitals. And the same day, you'll hear them writing, divorce NHIF from private hospitals. It's not by choice that these people are looking for better care. It is because they need to. They'd rather not be in those hospitals. That's true. But they're there because they're unwell. So cancer care in general, as a people, we need to wake up. And I do pray, it's election season. I do pray that as a people, we actually realize elections are about us. It's not about the leaders who are being elected.
That's true.
The leader still has that, but in fact, it's still about them. Until we ourselves wake up and say, okay, fine, I'm making a decision that will safeguard my future and that of my children, we will not come out of this problem. Life gets harder and harder for people after elections. So I do pray that for a change, as a people, we get angry enough and wake up and say that, no, I'll not vote for the politician, I'll vote for my wife, I'll vote for my child. And what does that mean? I'm voting for their future. So what policy is coming into place that's going to guarantee us healthcare, that's going to guarantee us education? What's going to make my life easier? And you may be surprised that all you have to do right now is, as a Luo teacher, you go embrace the Kalenjin teacher, and the Luo policeman embraces the Kikuyu policeman, because you are on the same page, you're looking for the same thing. The politicians looking for something different. Yeah. And we have to stand up for ourselves and be brighter and be better.
No better way to, close it out, but we also would accord Dr. 30 seconds of giving his parting shot. I can almost guarantee you that if we were to talk about cervical cancer, he'll speak of screening, but we can't stop talking about this. We can't say enough, right?
Absolutely. Take home message. You've said it. Ladies, which camera is it? This camera I look at?
Yes, this is the camera, Dr.
Please, I know many times people say things and it just passes you by until it's too late. For cervical cancer screening, it's very cheap, it's effective, it will save a life. So every 3 years, make a point of getting yourself screened.
That's true.
Just make a point, and not just yourself. Ladies around you, also get them screened. If you can afford or have access to the vaccine, go ahead and have that as well. Highly recommended. It will save you tremendous pain. Thank you very much. God bless. And
of course, on the eve of Women's Day, we always have these conversations as to cancer, cervical cancer, breast cancer. Very important that we engage and we make sure that what it is that the doctors speak of, they are specialists, then we get to listen to the same. Dr. Thank you so much for speaking to us this morning. It's always an honor having moments where we get to share matters, health, because they would say it is the greatest, wealth. It's always hard when really it hits home. I couldn't agree more. Dr. Victor Ngani, doctor, with the RFH family, that is the Rai Family Hospital. It is good to have you, and we're looking forward to have another session as we expound more on matters of health. Send our greetings there. We've been there, and we know that RFH is is a family and a friend of Morning Cafe, to be precise, and for that reason, we are grateful.
Thank you very much.
Asante sana. So we close this conversation at this particular point, not in totality. Remember, it's Morning Cafe and we're going all the way to 10 a.m. So in a bit, we come back with a conversation on money laundering.